Hi, this is Dr. Pandey. Welcomes you all to the Health Awareness video program. In our previous video program, we have seen the thyroid gland formation and thyroid hormone formation with its promotion on the different organs of the body. In today's video, let's have the glimpse of hypothyroidism. Hypothyroidism means low level of thyroid hormones, which is low T3 and T4. The word hypo means low and the word hyper means high. Now the hypothyroidism is categorized into three, which is primary hypothyroidism, central hypothyroidism, congenital hypothyroidism. Now let's see first the primary hypothyroidism, where our own antibodies acting against the thyroid gland, which in turns reduces the secretion of thyroid hormone. Now the best example for this is Hashimoto thyroiditis, where this is very commonly, the Hashimoto thyroiditis is commonly seen in females. Next, postpartum thyroiditis. This is where females, after giving birth, within 1 year, due to the inflammation, the thyroid hormone secretions has been reduced, which leads to hypothyroidism. Normally, females after delivery, after giving birth to a child, their immune system will decrease, which takes naturally for some time to cope up. Now, during this course of time, when the immune system is coming back to the normal, that point of time, few antibodies act against the thyroid gland, which leads to the reduced thyroid hormone secretion. Next is antibody like IgG4. Now here the best example for this, Riddle thyroiditis, where the normal thyroid gland tissues turns from normal to fibrous, which during this thyroiditis, the thyroid gland will look like a stone or same as like wood, which leads to the low thyroid hormone secretions. That leads to hypothyroidism. There are few viruses. The viral infection may also lead to the low secretions of thyroid hormone. Example, acute granulomatous thyroiditis, which is also called as SGT. Now, apart from this SGTs, commonly due to the viral infection, which turns up to the inflammation, that leads to the low secretions of thyroid hormone, which leads to hypothyroidism. There are few drugs which also leads to hypothyroidism. Their action also leads to hypothyroidism. Amiodarone, lithium, I-131. Amiodarone is anti-arrhythmic drug, which is a life-saving drug. Lithium is commonly used for bipolar disorders. I-131 is nothing but iodine 131, which is used for the diagnosis and the treatment of thyroid gland cancers. Apart from this, iodine is also the primary reason for hypothyroidism, where if you have low levels of iodine, that leads to the low levels of thyroid hormone secretion. Now let's see the central hypothyroidism. As in earlier we have discussed, that the hypothalamus secretes thyrotropin hormone, where the anterior pituitary secretes thyroid stimulating hormone, where the thyroid gland secretes thyroid hormone. Now, for any reason, hypothalamus reduces the secretion of thyrotropin hormone, which leads to the thyroid stimulating hormone secretion to be reduced, which in turn leads to thyroid hormone secretion reduced. That leads to hypothyroidism. This can be due to traumatic brain injuries. Now, let's see anterior pituitary. Now, for if any reason anterior pituitary reduces the secretion of thyroid stimulating hormone, that will lead to the low thyroid hormone secretions, which leads to hypothyroidism. Where good example for anterior pituitary could be Sheehan syndrome, where it's a state, it's a shock state where, severe hemorrhage during or after the delivery, during the pregnancy or after the delivery, which leads to the deficiency of pituitary gland hormone deficiencies. So, there the thyroid stimulating hormone secretion will also decreases. That leads to the thyroid hormone secretion. Apart from this, tumor also lead to the low thyrotropin hormone secretions as well as thyroid stimulating hormone secretion, which leads to low thyroid hormone secretions. That leads to hypothyroidism. Now, we see the last, congenital hypothyroidism, where in congenital hypothyroidism, maternal antibodies act against the thyroid gland of baby, which leads to low secretions of thyroid hormone. That leads to hypothyroidism. Here, the maternal antibodies plays a role of low thyroid hormones. If there is no thyroid gland formation, that means abscess of thyroid gland. What it is called? It is called agenesis. Where there is no thyroid gland, then there will be no thyroid hormone secretion, which leads to hypothyroidism. If there is a thyroid gland which is immature or improper formation, then there will be low thyroid hormone secretions. This is called as dysgenesis, which will also lead to hypothyroidism. Now, in our earlier videos, we have discussed the shape of follicular cells, where this follicular cell carry enzyme. Now, if there is a deficiency in the enzyme, then there will be a low secretion of thyroid hormone. Such deficiency of the enzyme will be called as dyshormonogenetic goiter. Now, we will quickly revive the hypothyroidism categories. There are three categories: primary hypothyroidism, central hypothyroidism, and congenital hypothyroidism. Where in primary hypothyroidism, our own antibodies act against the thyroid gland, which leads to the low thyroid hormone secretions. The good example for is Hashimoto thyroiditis, which is commonly seen in females. Next, postpartum thyroiditis, where within the first year of the delivery, due to the inflammation, the low levels of the thyroid hormone secretions have been seen, which leads to the hypothyroidism. Next, IgG4, where the antibody like IgG4, which is riddle thyroiditis, which turns the normal thyroid tissue with a fibrous tissue, which leads to the low thyroid hormone secretions. Next, we have seen virus inflamming or affecting thyroid gland to reduce the low thyroid hormone secretions. The good example for it, subacute granulomatous thyroiditis, which we call as SGT, which is commonly due to the viral infection. Now we see the drugs which are affecting the thyroid gland to reduce the or to decrease the secretion of thyroid hormone. Amiodarone, which is antiarrhythmic, commonly used for life saving. Lithium, which is used for as a bipolar disorder. I-131, which is iodine 131. This is used for commonly to diagnose and treat the thyroid gland cancers. Other one is iodine. If there is a low level of iodine in our body, then there will be low thyroid hormone secretions. That will lead to hypothyroidism. Now, in central hypothyroidism, if the hypothalamus due to any reason reduces the secretion of thyrotropin hormone, that will lead to thyroid stimulating hormone low secretions, which lead to low thyroid hormone secretions. The good reason can be traumatic brain injuries. And for anterior pituitary, if any reason the anterior pituitary reduces the secretion of thyroid stimulating hormone, that reduces the thyroid hormone secretion, which can lead to hypothyroidism. The good example for this is Sheehan syndrome, where the tumors also can influate the thyrotropin hormone secretions low, thyroid stimulating hormone low secretions, which leads to thyroid hormone low secretions that lead to hypothyroidism. The final one is congenital hypothyroidism, where the maternal antibodies acting against the baby's thyroid gland, which leads to the low thyroid hormone secretions. Apart from this, if there is no thyroid gland formation, that is called abscess thyroid gland, which is called as agenesis. When there is no thyroid gland, no thyroid hormone formation. When there is no thyroid hormone formation, leads to hypothyroidism. If the thyroid gland has been formed, it is immature or improper, then that will also lead to the low thyroid hormone secretions, which is also called as dysgenesis. Now, we know that the thyroid gland is made of follicular cells. If these follicular cells having the enzyme deficiency, such is called as dyshormonogenetic goiter, where that leads to low thyroid hormone secretions, which in turn leads to hypothyroidism. These are the few glimpses of hypothyroidism. In our next video, we'll come up with the further information with thyroidism. Thank you.